as we're addressing a global pandemic, I'm asking speakers and my colleagues to be really careful about implying that there is not an overwhelming body of scientific evidence that's in peer-reviewed journals and broadly accepted by the scientific community that supports that vaccines are safe and effective ways of stopping the spread of disease. So I just feel like every once in a while we need to make sure that we come back into tune with that and don't say you're asking for evidence. That's not how this body works, but there are lots of folks who I'm sure would be happy to share with you this evidence, but it is not the responsibility of the legislature in this forum to present that evidence to you, but there is a large and overwhelming amount of scientific evidence that supports that vaccines are safe and effective. And one of the most effective ways that we can slow the spread of diseases in communities, such as the response to the COVID pandemic, but also in a way that we can stop diseases that are were commonplace, but we are benefiting from generations of vaccination, decades of vaccination. So we're actually calling this time the post-elimination era. That is what the scientific community calls this time. Those vaccines eliminated it from common community spread, but we are no longer in the elimination era where those didn't exist. We are in the time that came afterward, where people not being vaccinated have reintroduced these conditions. So there is a strong and overwhelming body of scientific evidence. It does exist. And I think in another time and occasion, we can dive into that data, but this right now isn't the forum. And I do think we need to take a moment every once in a while to say that in the time of a global pandemic, using this as a platform to propagate misinformation is dangerous. And I just want people to sort of tune back in every once in a while and say, we just need to make sure that we understand the science. And so thank you.
Okay, if I could respond to that, I have a list right here of there's different studies. 100% whooping cough vaccinated school closes in Houston. Measles outbreak among vaccinated high school students. Measles outbreak, this is from PubMed. Measles outbreak in a fully immunized secondary school population. There's one about chickenpox in a fully vaccinated school, a mumps outbreak among fully vaccinated people from Scientific American, outbreak of varicella among vaccinated children, that's from the CDC. And then, there's various others. I just want to point that out, that just because you are in a 100% vaccinated population, it does not mean that outbreaks are going to occur. So what you were trying, number one, there's no problem here because we're not having outbreaks. But even if you removed every single unvaccinated child from school, you are still going to see outbreaks. So number one, no problem to solve. Number two, the solution would not solve any type of hypothetical problem that you are posing.
So the goal of public health is to prevent problems before they arise upstream, right? That's what we do. We want to focus on addressing things before they become a commonplace problem. But it is really important to note that the Scientific American is not a peer-reviewed scientific journal. And a lot of the things that you just listed are articles, like news articles. That's not peer-reviewed science. So I just
so two of them were from the CDC and one was from PubMed. I'm not clicking on them. I have a list right here, but you can go, you can do a search, just type in outbreak in fully vaccinated population, and you can find these things for yourself.
Sure, and that's called a confirmation bias. So like when you search specifically looking for something, you're going to find the thing you're looking for. So that is something that we know and understand in the scientific community. If you have a leading Google search, you will find things that confirm your suspicion. And so if I search, my PhD's in nutritional sciences, if I search, I can survive off of Twinkies, I will find something that says I can survive off of Twinkies. I do not advise doing that. And so I just think we have to be very careful. And I mean no disrespect by this. In a time of a pandemic, it's really, really important that we acknowledge the source of the information, of the things that we're sharing, because it matters where the information comes from. And it opens our community up to a threat when we elevate misinformation and we trust it as truth without sort of digging into the bottom of where that information is coming from and where it's being shared. So thank you very much. I appreciate you testifying